Hey everyone, it's Dr. Dave with Unlimited Medical Centers and Occupational Health, and I'm on a bit of a hand kick right now. So we're talking about another type of hand injury. Now I realize I didn't warn you, and you're looking at the hand of, unfortunately, a child that's lost kind of like the tip of the finger there. We're talking about this, admittedly from a walk-in point of view, but more so an occupational medicine point of view, because I do see a lot of people that, whether it's, a piece of sheet metal or something, some type of fall and crush injury, they have lost part of the tip of the finger. When I work in the emergency department, I got to tell you, mandolin slicers, wow, they love taking off the tip. Not this bad, but they will still take it off. A couple things can happen. We're going to need to wash it out. We are going to need to get x-rays to see how much bone is lost. And then we need to decide on what's going to happen for the repair of this. So I'm going to talk about it in terms of bone, skin, and then the nail. For most parts for the nail, we just let it be. We hope that the nail is going to come back in. If the base of the nail, where it kind of like knows to grow from, is intact, it should just come out. We used to put like a piece of tinfoil under. Sometimes we'll try to put the nail back if we can. However, that isn't always possible if there's been a lot of tissue damage. So for the nail, often we're not left with many options, and we just need to see what's going to happen. Now, when I look at the bone, so we need to get an x-ray and then see if bone is exposed. If bone is exposed, I'm always going to be starting someone on antibiotics, and then I'm always going to be reaching out to a hand or plastic surgeon to say, what do you want us to do to cover this? And then when will you follow them up? And usually they just want to make sure that our tetanus is up to date, that it's been washed clean, that you're on an appropriate antibiotic, and that we have a non-stick dressing that's going to be over that. If the bone is sticking out further than the skin, that's when they need to start considering, do we need to trim down the bone and then cover it with the leftover skin, or are they going to put a skin flap on? And that becomes a little complicated, which again is why we reach out to them. Now, the final bit is just regarding the soft tissue, the skin, the part of the skin that's underneath the nail, and then the soft tissue, like the little bit of fat that we all have in our fingers that makes up the pad. The question will then be, for the most part, well, would they want to cover it with a flap, the plastic surgeons or the hand surgeons, or would they just want it to heal on its own? And I'll tell you, if you don't have a lot of bone exposed, or there's still a lot of tissue there, oftentimes they want it to grow in by secondary intention. And what that means is that instead, like if we can't close it with a stitch and we're not going to put a flap over it, they just want wet to dry dressings, so ones that won't stick to the dressings that won't stick to the area. And then what happens is your body slowly grows like new tissue from the bottom up, and then finally normal skin. Will it look perfectly normal? No. But even if we closed it with a stitch or you went to an operative procedure, it's still not going to look normal. And things like flaps, they have complications, and they're still not the easiest thing to do. And so when we reach out to our hand surgeons, and I've had to talk with them 3 times within the last week about issues like this, they're always saying, just let it heal on its own. Yes, it's going to take 6, 8, 10 weeks, but they're going to have a better cosmetic outcome. But more than that, the plastic surgeons have told me they will get a better outcome in terms of their nerve sensation. They're not going to have a numb finger at the end as likely. It will come back slowly, but they will have better sensation. And that way you know what you're doing when you're playing the piano or holding a pen or anything else. So this is just a little bit of some of the things that we think about when we see where you've lost a little bit of the finger, and why it may seem that we're not rushing you to surgery or to see a plastic surgeon, because the best outcomes come from a more conservative approach when we just support your body in what it's going to do.